Hi everyone, we're back. And the topic for discussion today is about two nurses having a discussion. One is experienced and one isn't, and the challenges that they face, of course, over morning coffee. One is saying to the other, floating for a new nurse is difficult. And the other says, I'm old to nursing, but floating makes me feel like a fish out of water. I'm sure it does. Floating to an unfamiliar area is not easy. It is not even easy for a nurse floating. If you're new, it's bad enough, but take the nurse who is old and has worked in an area for 10, 15 years, suddenly finds herself, like, say, an ICU, being out onto a surgical floor. The way you pace yourself is different. What happens is different. It is just such a different environment that there is a lot to learn. And sometimes what people do, they get all angry and agitated, and this does not make for a good shift, and it doesn't make a relationship with your coworkers very good. Floating in the clinical setting may be necessary to meet staffing needs first of all. And the nurse who floats may feel like a fish out of water, that's true. But what can you really do to make the situation better? Here are some helpful suggestions. Try to stay calm. You have a choice. You can either be very angry and uptight and just be very grudging of the situation and make it a miserable day, or you can just take it as a learning experience, get an orientation, take the time to look at the care plan, the patient's diagnosis, medications, and have a resource, anything you can learn from someone who is familiar with the area. This will also be very helpful. And it makes for learning too, even though people may not see it that way. When you go to a different area, there's always something to be learned, a lesson to be learned. If you take it as a learning experience, then it won't make you so miserable. So here is what I wanted to emphasize. Floating can be totally out of the control of the staff. Staffing needs have to be met, regardless of where you work. There's got to be good staff coverage, skill level. Here's the case of one nurse who's been up all night with a baby who was sick, and she's not able to go to work. Well, someone's got to take her place on that shift. This was not intentional, but it happened. Then sometimes you have in an area things like multiple traumas. You may have situations where, let's say there's a bus turned over, a car accident, or a pileup on the motorway, and lots of people are just traumas all at the same time. And people do have to go out and take care of these patients, and it interrupts staffing, and you find yourself being put in an area that you're not familiar with, and you're forced to make the best of it. That's all you can do, the best job that you can do. Make the best of it, not to grumble and feel that because you have been displaced from your zone, that means that the whole day has to be miserable. Here are some examples of what you might find as you float to different areas. I worked in neurotrauma ICU for many years, and one of the concerns was many times people would come from the cardiac ICU, be floated of course, and their main concern would be lowering the blood pressure. And the patient with a brain event may require higher blood pressure for cerebral perfusion. This was a real problem. The cardiac nurse always looked and said, oh, that blood pressure is so high. But sometimes it was kept intentionally higher than normal, let's say 140s, 160s, to give the brain better perfusion. So there's always a lesson to be learned. Not just looking at it as doing what I normally do in my area, more looking at it as, is there a lesson to be learned, and follow the instructions. It makes life easier. Then you also have like cardiac patients, like I said, you may have been floated to a cardiac ICU where things are done very differently. Here is the case of another nurse who is floated. And in this case, this nurse exchanges report as the other girl goes on her lunch break. A patient calls, the patient in her care, of course the nurse is at lunch, so she takes over, calls her and says, Nurse, I'm having chest pain. What does the nurse say? She will let her nurse know when she comes back from lunch. Well, that's not good enough, because what happens in the meantime if it was really that patient was having a myocardial infarction? It's very important to remember, regardless of where you work, you try to do an assessment, some documentation, then you follow through on whatever happened, whether you have to ask someone to help you, do what needs to be done, call the doctor, whatever it takes, but don't just leave it as I didn't know what to do, so I'll leave it till the other person comes back. In fact, this turns into a bit of a nightmare because the patient's sister arrives and is very upset about what has happened. And I know these things can happen, but how can we avoid them happening? Hope you've learned something from this. Have a great day.